Absolutely. I have study tricks for pathophysiology for nursing students. And I'll even give you an example. I'll do an example on cancer so you can understand everything you need to know about cancer for nursing school. The trick to making pathophysiology easier comes down to 4 easy steps. And sometimes it's only 3 if you're taking it like as a prerequisite. It just depends on where it fits into your particular nursing program. So let's talk about how we would make studying cancer easier. Step 1 is that you need to ask yourself, what do I need to know about normal before I can begin to understand cancer? By the way, if you're not already familiar with my Silver Bullet study system, you can get a free 10-minute video overview of the entire thing, plus this download for free in my bio link. So with cancer, what we need to know about normal is going to have a lot to do with cell division. So let's say we're just generally learning about cancer. It's going to have to do a lot with mitosis. Also, genetics, some basics about DNA. If you're studying a very specific type of cancer, say like stomach cancer or liver cancer, then you also need to review the normal anatomy and physiology of the specific body system that has the cancer. Step 2 is probably what you are studying now, which is what is more traditionally thought of as the pathophysiology. It's because we're asking what has broken or changed in the condition that we are reviewing. But if you haven't taken the time to review normal in step 1, then step 2 just becomes memorization. And you'll never be able to connect the dots, which is going to make retaining it really, really hard. Most nursing students skip step 1, which is why nursing school continues to be so hard for you. And you don't really understand what the test questions are asking you. But now that you know, all you have to do to define the pathophysiology is be comparing it to something in step 1. And make it as simple as possible, like you're explaining it to a 4th grader. For cancer, I usually like to explain it that there's one of 2 genetic mutations going wrong. Obviously, this is a little bit simplified, but you just need to be a safe, effective beginning nurse. You're not looking to become like a super worldwide cancer specialist right now. Genetic mutation number 1 is that the brakes are broken. Our body cells normally have DNA that kind of sets the rate for how fast or slow the cells should replicate. If they start replicating too fast, it hits the brake. But with this genetic mutation, the brakes are broken. The second type of genetic mutation is the gas pedal is down. It's kind of the opposite side of the coin for the first genetic mutation. It's not just that the cell is unable to stop replicating like with the brakes, but the fact that it is actually pushing to replicate more quickly than it's supposed to. Now already you can tell that if somebody has one type of this mutation, their cancer is probably going to be a little bit easier to treat than if they have both types of mutation. Make sense? Which means that if you have to prioritize questions like this on a test, now you have a strategy for how to compare some different types of cancer. Now we move on to step 3, and this is going to really save your brain when it comes to memorizing symptoms, because you don't have to memorize symptoms anymore. You can just literally figure them out on the spot. So with step 3, we're going to predict what happens next. We know what normal is. We know what is broken. What's going to happen next? So if the brakes are broken, if the gas pedal is down, we know that cells are going to be replicating, cancer cells are going to be replicating faster than they should be. Obviously, this causes problems because if these cells are so busy replicating faster than they're supposed to, it means they're not doing the job that they are supposed to be doing. So if you are, again, studying a specific body system that has cancer, whatever job that cell is supposed to be doing is not getting done, and those are the symptoms you're going to see. Not only that, but a tumor. A tumor is going to be a mass of cells that have outgrown the space that they were supposed to be in. You might even have to go back and review a little bit about cell differentiation and specialization in step 1, because the more often and the faster cells divide, the more likely there is to be another DNA mutation based on what we know about how that happens in step 1. It also explains why certain types of cancers tend to be slower growing than others. For example, brain cancer tends to be a little bit slower growing because brain cells just don't duplicate that often normally. So speeding them up is still slow compared to some other types of cells. There's lots of factors that influence this, but for nursing school, you're looking for general patterns. Then we get to step 4, which is, what are we going to do about this? And y'all, this is where it really gets cool. Because I'm sure you've heard of like the chemotherapy drugs and the radiation, but why do they work? And of course, surgical removal of a tumor too. But radiation, and especially chemo, it works because it capitalizes on the fact that these cells are duplicating so fast, and it causes damage to cells. Now, chemotherapy drugs, they're not specific to only cancer cells. They damage your healthy cells too. But the difference is that your healthy cells are not replicating too fast, which means they have time to repair the damage that the chemotherapy does before they replicate. It's only if the cells try to replicate while the damage is still active that they're more likely to die. And which cells are replicating the fastest? The cancer cells. So the cancer cells are most likely to be killed by the chemotherapy or radiation. This also explains the side effects that we commonly see with chemo. Because take a second, put it in the comments, what are the 3 systems in your body, the cells, that replicate the fastest? I'm looking at the hair, I'm looking at the mucous membrane and the digestive tract, and I'm looking at the white blood cells of your immune system. Also the male reproductive sperm. That's your bonus 4th. These are normal cells that tend to replicate quicker in the body, so these are the ones that we see the most side effects from chemotherapy drugs. You lose your hair, you feel nauseous, you get sores in your mouth, your white blood cell count drops, making you more susceptible to infection. But here's where I really geek out, because one of the side effects of chemotherapy drugs is a risk of cancer later on. Why is that? Why does the medication we give for cancer cause cancer? It's because it's damaging these cells, causing DNA mutations, much of which can get fixed by healthy cells, but not all of it. Anytime you increase DNA mutations, you run the risk of creating genetic mutation number 1 or genetic mutation number 2 that cause cancer. So the chemotherapy drugs, they are getting rid of the cancer, but they're also increasing the risk for cancer in the future. This is the same reason why, especially if you're younger when you're doing chemotherapy drugs, but really at any age, chemotherapy drugs can also interfere with fertility because it can cause genetic mutations in the egg cells or the sperm producing cells. And those mutations, once they're there, they last forever. And once you connect the dots using the 4 steps, it's really a lot easier. Like people I teach this to, when I'm teaching my tutoring students cancer, they never forget about cancer. So if y'all want a free 10-minute overview intro to Silver Bullet Study System, remember you can get that in my bio link. But also, just don't forget to follow me. Do not trust the TikTok algorithm to find me again.